If any of our listeners are afraid of losing a team member, because I have to think that that's on almost every dentist's mind, where do they start? Where could they start to be proactive about that and perhaps create an environment where someone doesn't want to leave?
Yeah, this is often the reason that a doctor will call me and want to do one-on-one coaching consulting for leadership. And in the conversation, I really do try to find out how long they have felt that way and listen to what the team member has said or done that communicates that. And my first response is usually the fact that they don't want to make decisions from a position of weakness, that always you want to make those really important decisions when you feel good about yourself, you feel good about the practice and the patient base and what you have to offer. But a lot of people don't get leadership training, do they, when they're in right? Or maybe they haven't had a whole lot of other leadership role models or work experience, but functioning from a position of fear is actually the worst place to be. And as they're talking about the present situation, we dig deeper, we can see or hear that it's actually been fairly long-standing. By the time they call me or reach out, they're functioning, daily. Gary, there are dentists who dread seeing their team or walking in the door because they feel like it's one of animosity, and that's just the worst thing. So the best advice I can give is you have everything to offer the right person for you. I wouldn't be too surprised if you'd made unknowingly some mistakes along the way that created this environment, because I'm a big believer in the fact that you train other people how to treat you. And if you're in a position of fear that someone will leave you, that means the other person chose to create that environment, and that supposition serves them well. And then there's some work to do.
Yeah, absolutely. And I think, the idea of creating an environment where we attract and keep the best team members is so critical for us today.